Okay, well, it's been a little bit. A couple bits of information have come out. So I did my second CT scan. Kind of came out of the blue. I thought I was going to do it between my fourth and fifth chemo sessions, but it ended up being between my fifth and sixth. At least I think I've done five. It's starting to all mash together now. Um, and I got the results back, and they said that the lesion had shrunk. That's my dog in the background. The lesion had shrunk. That they It looks like there's some more buildup in my stomach, but that could be dead cells. There's been no spread, so he said overall everything looks really good from the second CT scan. So, yay! Um, Really, that's kind of what I was hoping for and shooting for. So I guess I got the best result possible. Although I'd rather them say definitively, yeah, those are dead cells in your stomach, um, which they're going to scoop out. And so the day I got my CT scan, which was last Wednesday, about an hour before that, I get a call and they want to schedule my surgery. And I told them, I said, well, wouldn't you schedule the surgery after I get my CT scan results so you can look at it? And they said, no, we'll just do it now. And if the CT result, shows anything different, then we'll change accordingly. So last Wednesday, they called. They said, okay, when are we doing this? And it's tomorrow. So last Wednesday, I've scheduled an appointment for surgery for this Wednesday. So I go in tomorrow, 5:30 in the morning. I have to be there. The procedure itself is at 7:30, and they said it can be 4 to 10 hours of surgery. I did clarify also, what am I looking at for recovery time? And they said best case scenario, overnight in the hospital, like 2 weeks at home recovering. Middle case scenario was 4 to 5 days in the hospital, and then like a month of recovery at home. And worst case scenario is like 8 days in the hospital. So 8 days is the max. So in an earlier video, I thought I might be in there in the hospital for months. 8 days apparently is the most I'll be in. But it could be 2 to 3 months of recovery. So that would suck. Um, so yeah, there you go. Surgery tomorrow. Other than that, to prepare for the surgery, I had to clean out. If you've had a colonoscopy, you know the fluids you got to take and everything to clear your system out. I had to do that. Gave me some antibiotics. First time ever that I've taken a pill antibiotic, and it almost made me throw up. Every now and then you take a pill and it gets stuck on the roof of your mouth or something because your mouth is dry. That happened, and oh my God, it was the worst tasting antibiotic ever. It was horrible. Think, why not spend the extra 2 cents and coat it with something? God, it was horrible. So I had to take 2 pills at 1, 2 pills at 2, and I got to wake up because I got to go to bed early. Got to wake up at 11 and take 2 more of these 2 antibiotics. And then I got to wake up at 3 and take some energy drink, and they give you 15 minutes to drink all that. So, yay. Not looking forward to it. Hopefully it tastes better than the other stuff. So, yeah, that's my updates. Surgery tomorrow. Did clarify a little bit more on what they're taking out of me. Appendix gone, gallbladder gone, part of my stomach gone, a foot of my intestine or colon gone. They named 2 other things that are gone, but like one was like I think some flappy thing, and honestly I don't care. I mean, it's not like I'm going to go, all those things you're going to take out, that's fine, but I want the appendix. No, it's got cancer. You get rid of it. Who cares? Deal with the repercussions afterwards. Am I nervous about surgery tomorrow? Not a bit. I'm not anxious for it. I'm more looking forward to getting it over with, just so I can start the recovery process, and probably have to get some chemo afterwards to make sure it got everything. Um, and the last chemo I did really sucked. I mean, as you can see, my hair is, I lost a lot of hair. Um, and it's all white now. I mean, before I had some dark in there, but man, cancer sucks. Um, I had the cold sensation in my mouth and in my hands and feet for almost the week and a half, the 2 weeks between infusion times. It finally went away, I'd say late Saturday, and that was the previous Wednesday that I got it done. Um, Also, the cold sensitivity of drinking. Um, right now, I can drink anything, but Saturday I couldn't, and so it's like, God, just get this over with. Still have my cough, but it's not that bad. Um, they went over all this stuff about, you know, for the anesthesiologist, they got to check all these questions, and um, basically, you know, it's amazing when they go through them. Do you drink? Do you smoke? Do you this? Do you that? How many I said no to? And it's like, all those things that I said no to, and I still got cancer. Go figure. Um, so I guess if they're removing part of my stomach, which I'd forgotten, I'll be losing some weight, because I didn't lose any during this chemo time. Maybe about 5 pounds, and that would have been this last time, just because I couldn't really eat anything. And you know what really sucks is I loved sandwiches, like deli sandwiches. I can't even think about them right now. When I brought one in the last time during my chemo session, just looking at it made me queasy. I just thinking about it now makes me queasy. Now I'm going to associate a sandwich with chemo. So if you do end up having chemo, bring in food that you're not 100% happy with, because you don't want to have the chance where it affects you like me now, where I don't even want to think about eating it. Um, Now that doesn't mean every sandwich. I made some chicken cheesesteaks the other night, and that was awesome. But definitely no more Safeway pre-made, or not. It wasn't even pre-made. I had to make it at the deli, and I have no desire to eat that ever again. So, yeah. Well, there you go. Next time I'll be recording, I'll have had surgery and be recovering at home. So, yeah, there's that to look forward to. I've got my iPhone. I've got my iPad. I can't bring any of that with me. It's not until after the surgery somebody can drop it off. But if I'm going to be in the hospital over a day, really won't make much difference. But if it's the 4 to 5 days, having a Plex server with access to tons of stuff to watch. Plus, I mean, I've got Netflix and Disney Plus and Hulu and Amazon. So it's not like in the 70s where there was 4 channels and you had to watch whatever there was. I'll pretty much, TV wise, I'll be fine. And apparently they're putting me in the ICU, so that I think that means that I'll have my own room. And so if I'm only there one night and have my own room, that'd be pretty cool. I'll get some good sleep, and hopefully 2 weeks at home and then back at work. And I let everybody know, all my customers, that I'd basically be gone for through next week. I don't know if that 2 weeks means 2 weeks from the surgery date. If so, I was under by about 3 days, but I won't have to have anyone take over any of my stuff for me. I can just go right back into it. So here's hoping. 1 overnight in the hospital, 2 weeks of recovery, back to normal, then some more chemo, and I got everything and killed it all, and I'll be good to go. And then we'll worry about dietary restrictions or any of the outcome of all that. So Um, Signing off, and I'll talk to you next time, weighing a lot less with all the organs they're taking out of me. Talk to you later.